Our next speaker is going to talk on the medical perspective of infectious diseases with an emphasis on ear, nose, and throat. And you all have his bio in your program, so you can read that. Because what you may not know is who remembers our own famed photographer Cliff Rolls? Raise your hand. Okay. After misdiagnosis of Cliff's health issue as Bell's palsy with his droopy mouth and left eye, Cliff found his way to Dr. Wazen, who discovered the real reason, a parotid gland tumor under his left ear, and the rest is history. So I would like to introduce to you Dr. Rick Wazen, who moved back here about 19 years ago, and I'm not reading his bio because I can't pronounce most of those words.
Good morning. Thank you, Bob, for inviting me to participate in this fabulous meeting. I was talking about this to some friends, and somebody said to me, you better be careful. I said, about what? They said, you know, you cannot mention those words, those illegal words. And I said, I'll try, but excuse me if I mention the word warming or things like that are criminal. I feel like we're preaching to the choir here. And our earlier speaker said we have to teach the medical students and the medical schools and so on. And that's easier than how do we teach our public servants? How do we teach our local governments? How do we teach Congress? How do we teach the White House? Those people have the keys to a lot of what we want to achieve. And I think that is such a challenging task. And I don't know, maybe Bob can figure it out. So, all right. So why ear, nose, and throat, and why head and neck? You know, our head and neck area is basically the entrance into our system. Our breathing, our eating, it all comes in from here. So our exposure to our environment begins in the upper airway and becomes in the upper aerodigestive tract. So we all spoke about tragedies and so on. This is my house before Helene, and you could see it. We already had the shields, the hurricane shields there, because we didn't want to break the glass. But this is our house now. So we pretty much lost the whole main floor of the house, and then we're fighting back to recover. And how much do we recover? And do we want to stay? Do we want to go? And it's like a song. So climate change refers to a significant shift in global temperatures and weather patterns over decades. And we've seen that spoken before. It's primarily driven by greenhouse gases. The health impacts include respiratory stress, cardiovascular stress, and the susceptibility to infection in our upper airway and in our body in general. So what happens when we have pollutants in the air? There are pollutants that are called PM 2.5, that's particulate matter. 2.5 is the size of the pollutant. And ozone, they penetrate into the respiratory tract and lead into the mucosal barrier. The mucosa is the lining inside your nose and inside your mouth. Mucosal barriers are different than skin. Skin is a little bit more resistant than your internal mucosa. And it said that it's more important in urban areas. And I've heard that earlier from a previous speaker talking about how urban areas are more susceptible to increased heat and such complications because of the buildings, because of the reduction in airflow, because of the increased heat from all the cement and so on. We moved here from New York City, and sometimes walking down the street with all the tall buildings and the roads and the cement was so hot you really did not want to do that. You wanted to go into air conditioning places. So, and we are a little New York City here now in Sarasota. I mean, look around. When we moved here, we didn't see all of these tall buildings and we didn't see all of this construction, but we're getting there. So this is a picture, and let's see if we could see it here. It's a little bit small. This is a picture of the ear system. Okay, so the ear, you have the external ear, you have the ear canal, eardrum, middle ear space, inner ear, and then it goes to the brain. So one connection between the upper airway system and the ear is through something called the eustachian tube. And the eustachian tube is this thing here that connects the middle ear space to the back of your nose. So if I put something straight through your nose to the back of your nose, I'm going to enter the opening of that eustachian tube. And then the purpose of the eustachian tube is to provide ventilation and air pressure equilibration between the outside world and the middle ear. And that's what's going to allow the drum to vibrate like a drum. If there are problems in the eustachian tube area, then your ear will not function well. You get a feeling of fullness, pressure, you get fluid in the ear, you get hearing loss, you get dizziness, you get ringing in your ears, etc., etc. So, now if you follow that, we'll see that there is an impact of air quality change on the function of the ear and the eustachian tubes. There is, and studies have shown that there is an increase in the incidence of otitis media, which is middle ear infections. There's also an increased incidence of otitis externa. We all know about swimmer's ears. Now, swimmer's ears are from infection in the outer ear canal, and it comes from polluted water. With more heat, there is more pollution, there is more ear infections. And there is one condition of the ear that we know of that is much more common in Florida than it was in New York, where I did my training. I practiced for 23 years. It's called malignant otitis externa. It's called malignant not because it's a cancer. It's not a cancer. It's malignant because it kills you by infection, not by cancer. So another term for it, medical term, is necrotizing otitis externa. It creates necrosis in the skull base. It enters into your skull base, into the bone, and it goes into your brain, and eventually you're dead. This is much more common. It was described initially in Miami by Chandler, and that is much more common in hot, humid climates. It's much more common in people who have reduced immunity. So if you're diabetic, if you are a cancer survivor, if you are on therapy or steroids or something, and you get that kind of an infection, you better run quickly to your doctor to get it treated. Not everybody dies from it, but if you ignore it, you do. There are other infections or conditions of the ear that we know are climate related. And one of them is called Meniere disease. Does anybody heard of Meniere disease? A lot of people have, yeah. So I had a patient with Meniere disease, and her husband tells me, and I like that quote, he says, "I can predict the weather from my wife's ear." So Meniere disease is a condition of the inner ear that causes recurrent attacks of vertigo, nausea, vomiting, loss of hearing, tinnitus. It's quite disabling for those who suffer from it. And it is more common, or it happens with weather changes. So on a rainy, stormy day, the ear feels the change in atmospheric pressure. The ear becomes more full and blocked, and then following that, the vertigo occurs. So another feature of this disease, which is atmospheric pressure or pressure related, is that people with Meniere disease feel better, their ear clears and opens up at 30,000 feet. You get on a plane, your ear is full at sea level, you get up there, and all of a sudden you're cured. But you cannot live up there. So you come down, and we're back into the same situation. So there is a relationship between atmospheric pressure changes and inner ear function. There is a relationship between heat and infectious diseases of the ear. The corollary of that, which we see in cold situations, and I used to treat the New York diving team, so the police. So they used to dive and swim in the East River, and they trained there. And they would come to us because they have these growths in the ear canal called exostosis that block the ear canal. They're bony growths, and it is that contact between cold water and the thin layer of skin in the ear canal that transmits to the bone, and those growths happen. We don't know why it happens, but that's what happens. So when I see that here in Florida, I know that they came from Michigan or New York, or they swam in cold waters sometime before. So another factor, body temperature, air temperature, water temperature affecting health. So we talked about that. All right, noise pollution. Migration, we talked about migration earlier. The more people migrate into cities, the more noise there is in the cities. We know about noise pollution if you are working at the airport, or you're working in factories, or you're working in a nightclub, and so on. Loud noise exposure is causing loss of hearing, tinnitus. But noise exposure could go undetected when you're living in urban areas. They had studies many years ago where they measured hearing in urban areas, and they measured hearing in African tribes. And in general, removing the genetic parts of it, the more noise you're exposed to in your life, the more hearing loss you're going to get as you age. So with migration, urban migration, we're going to get more noise exposure, more loss of hearing from noise, and we're going to get tinnitus. And everybody wants a cure for tinnitus. We don't have it yet, but it's coming. Protecting your ears from noise is the only thing we have now to prevent that. So those were a few words about how all of this is affecting our ear system, our eustachian tube function, and so on. Now, let's talk about the nose and the sinuses. So, can you see these pictures? I think they're too small. So, the nasal passage, the sinuses, these are the maxillary sinuses, ethmoid sinuses, frontal sinuses, and this sinus here in the center of the head is called the sphenoid sinus. If you look, the center of the nose has the septum. The septum is this bar which is made of cartilage and bone that separate your nasal passage into two chambers. On the outer side of the nose are things called the turbinates. These layers are called the turbinates. The turbinates are the filters and the air conditioners of the air that we are breathing. So as you breathe, those tissues here are supposed to grab onto pollen and small particles. It's supposed to warm up and humidify the air that you're breathing. And that's the function of the turbinates. So what happens when there is a change in our environment? We used to dislike October a lot in New York City because in October, it gets cold and the heat goes on in the apartments and it gets very dry. So in October, anybody who's going to get a nosebleed will get a nosebleed. And we would treat nosebleeds right and left because of the dryness and the desiccation of the membranes in those turbinates. It also causes nasal congestion because the turbinates have to do more work to humidify. So the turbinates get congested, you have nasal obstruction, you're snoring more, you're having obstructive sleep apnea more, and so on and so on. Little things that you don't think about really affect us, affect our body, affect our function. So there is prolonged pollen seasons due to climate change. The CO2 levels are also changing the potency of pollen. So if your body is used to or was used to a certain level of immune reaction to fight things you're allergic to, because of the CO2 levels, those pollens are becoming more potent and you are becoming more allergic than you used to be. It not only affects your nasal breathing and your sinus conditions, it also affects your pulmonary system, asthma, chronic bronchitis, and so on. So we divide our airway into the upper airway, which stops here into your throat, larynx, and then the lower airway, which is your lungs. And then maybe Dr. Volker will talk a little bit more about the lung issues later. So with air pollution, there's increased rhinosinusitis. Rhinosinusitis is inflammation in the nasal passages and in the sinuses. When your nasal passages are getting more inflamed, they block the ventilation to your sinuses. A body cavity that is blocked gets infected. So you get sinusitis. Sinusitis, pain, nasal discharge. If you've ever had sinusitis, you know what I'm talking about. Headaches. So with the pollution, with the particulate matter, with the ozone layers, we're getting more exposure and more inflammation in the sinus cavities, and we're getting more infections. Now, sometimes what happens is that these infections are viral or they're allergic. And what do people do when they think they have sinusitis? They take antibiotics. You take antibiotics right and left. Did anybody take Z-Pak? Everybody takes Z-Pak. You sneeze, you get a Z-Pak. You have a headache, you get a Z-Pak. What used to respond to Z-Pak does not respond to Z-Pak anymore. So you might as well take a sugar pill and it has the same effect as Z-Pak because it's viral. So when we're dealing with inflammation, you need to separate in your mind whether that inflammation is an allergic immunologic kind of inflammation, which is non-viral, non-bacterial, or whether it's the viral type of disorder where you could take all the antibiotics in the world, all they do is to promote resistance, or it's a true bacterial infection where you have to take the appropriate antibiotic for the appropriate bacteria. So that resistance is promoted also by the increase in symptoms that people assume always that it is bacterial, while it may not be. We know that there is an increased incidence of viral infections with temperature changes, whether it's high, warmer temperature changes, or when it's cold. You know, people catch a cold. Why do they catch a cold? Because it's cold. And why is it? It affects your immune system. It affects how your body reacts to viruses and bacteria. And then with the change in the climate, we have those viral mutations. Viruses mutate. They change every year. We have to have a new or a different flu vaccine because last year's flu is not this year's flu. They mutate. COVID, they change, they mutate. So that's part of the environmental influence on viruses that change. Now we'll go one layer below and we're talking about the larynx now. The larynx is your voice box. So you have your your nasal passages here, those turbinates, and then the air has to come down here and has to go down into your trachea. And this is the voice box. This is another view of it, and the vocal cords are here. Those are the vocal cords close together, and these are the vocal cords that are open. And the larynx is what makes you phonate. And the vocal cords close like this in a out and in fashion. And when you are speaking, your vocal cords are coming together, and the air from your lungs are vibrating those vocal cords like the string of a guitar or a piano, and that's what makes you phonate. So what happens in the larynx is similar to what happens in the upper airway, in the eustachian tubes, or in the nose and the sinuses. With exposure to airborne pollution and to CO2 and to particulate matter, you're going to get laryngitis, inflammation of the larynx. You're going to get hoarse because of that. And people who use their voices a lot, like me, or teachers or politicians, they get vocal cord nodules or vocal cord polyps because of the overuse of the vocal cords. All of that pollution and inflammation will increase the risk of hoarseness, vocal cord nodules, vocal cord polyps. And let's not forget to mention smoking, and other pollutants that we impose on ourselves. So those exposures are increasing the incidence of laryngeal disease. And what happens also when it's hot, and we've heard about all the heat around us here, that creates dryness in the membranes. And when your membranes are dry, they don't work well. It's not comfortable. You're going to get cough, and you're going to get hoarseness, and you're going to get more nodules or polyps. See, I cough and everybody coughs. That's the power of suggestion. So heat and laryngeal dehydration, we talked a little bit about that. Cold-induced laryngeal constrictions. You know, if you hurt something, you want to put ice on it because it constricts the blood vessels and it reduces the swelling. Well, if you constrict the blood vessels in your membranes, that is going to dry them up even more. So you have the heat that is causing dryness, and you have the cold that is causing dryness as well. So the body must have a temperate environment for it to function well. We didn't talk much about wildfires. It's not our problem here. Well, maybe it was maybe last year or something, there was some fires in Florida. But if you go to Colorado, you go to California, there's wildfire smoke, which is very toxic to our system, creating more vocal cord and laryngeal issues. And with that, with all of this inflammation, people tend to use more steroids. And steroids have their own side effects. So you get steroid side effects because you're using steroids to help reduce inflammation. Allergies, mainstay of chronic rhinosinusitis. You're allergic to diseases, you're allergic, pollen. Allergies are increasing in incidence with climate change. And allergies are creating more resistance to immunological immune treatment, to allergy management, to allergy treatment. The more air pollution, the more we get sensitization or resistance to treatment with allergic managements. There are new allergens that are coming into the picture. I think Rick showed that how things are migrating. And there are areas that did not have ragweed that now have ragweed because the climate has changed and certain vegetations and trees are new to certain environments, and people who were never allergic to certain things now are becoming allergic to it because it's new into their system. There's also cross-reactivity between allergens. You know, if you're allergic to birch, you're allergic to apples. You didn't know that. But there are certain things that if you know you're allergic to, then you're allergic to something else. So, in summary, you know, the climate is our environment. Whatever we're breathing, whatever we're eating is affecting our health in general. Is it causing infections? Is it causing inflammation? Is it causing degenerative changes? All of that is part of our environment. And the more we are aware of our environment and able to control our environment to the best we can, we are helping ourselves live better, protect our bodies from all of these noxious elements, whether they are particulate matters or smoke or dryness or water or drowning or whatever it is. So we're very much aware of that, and we want to continue to do research in protecting our bodies from such changes. And thank you, Bob, and thank you for all of you who are interested in this field. And I hope in my, maybe over the time presentation, I hope I have summarized how our upper airway is facing our environmental changes. Thank you.